My name is Charlotte Durrant. I am an oncology colorectal clinical nurse specialist at Ipswich Hospital. My role entails key working patients who are receiving treatment for colorectal cancer. That can be in the curative setting or the pre-op setting, or unfortunately in the palliative setting. My granddad died of stomach cancer when I was 17. And it was back in the days where you had the community MAC nurses and they looked after people in their own homes. And he died peacefully, surrounded by his family. And I wanted to do that. I wanted to make sure that people had good care. So I decided to do a few various jobs in care and then got accepted on a nursing course in 2003. And oncology was always the goal. So I came to oncology in 2006 and I haven't left. I love the work, I love the people, and I was lucky enough to become a specialist nurse 10 years ago. For my patient, I act as an advocate in their care. I'm specialist in the knowledge of the treatments that I have to guide people through treatment, help them understand the pathways, support them, support their families, and just offer a specialist service. I think you have to be patient. I think you have to understand. Everybody's journey is really different. You could have anxiety, grief, anger. Some people say they just don't care. The diagnosis is life-changing, and you have to be able to adapt to everybody's situation. You've got young parents, you've got older patients, and it's just being able to adapt to everybody's needs and just be patient. You can't make things better, but you can help them on the journey. And I think that's what you need to be able to do.
So I'm more of an Angus. I'm the lead cancer nurse for ESNEFT. So in my role as a lead cancer nurse, it's about ensuring that patients are getting the best quality care and the very best experience of their care. So what I'm really passionate about is a real sort of multi-professional team approach to how do we deliver that. But it's also about how do we deliver the best and continue to deliver the best. How do we ensure that people can live the best lives that they can do? It's not just about treating somebody in the here and today. It's about what's their life going to be like afterwards.
We can support them on a journey that, unfortunately, the journey isn't a curative journey, but we can just help them and support them. And sometimes it's chaos and sometimes it's calm, but actually sometimes driving home, you know that you've made a difference and that you have helped. And it could be something really simple like a form to allow them not to have to struggle financially. It's those really tiny things that make a massive difference that makes it worth leaving the house at 6:30 in the morning when it's dark. I've got a lot of patients who are similar age to me, and you have to have a lot of empathy. They're parents, the same as I'm a parent, and actually you want them to know you're their nurse, you're their specialist, you're a little bit of everything, and it is having them conversations to get to know them. If you've got an incurable cancer, you want someone to understand what they're going through. They're dealing with cancer, but they're also a mum or a dad, and you have to be able to care, because if you don't care, there's no point being here. And one of the things I do say to my patients, you have to imagine you're in your 40s, you've been diagnosed with incurable bowel cancer, you're coming for chemo. You walk in here and everyone's chatty, and the experience of patients afterwards, they sit close to each other, they talk to each other, they have support, they have a safe environment. It's friendly, it's funny. You can feel if you need to have a cry in the corner, there's someone to have a cry in the corner with. Friendships are developed here. I know patients that still support each other years after having treatment. You meet someone on a journey too, and actually you form a bond, don't you? That it's a strange, weird feeling, but it's like that kind of arm hug that you can walk in, you see someone smiling, and it isn't doom and gloom.
For me, what's exciting is about working with all those diverse people. It's working with all the multi-professionals who are really passionate about what they do. So what gets me up in the morning is them, it's the team, it's the patient, it's seeing how passionate our teams are about what they do every day. It's the empathy and compassion, the drive to want to make a difference, having a really personalised approach to the person in front of them and their family. and having a sort of real will to sort of learn and develop. But ultimately, it's about the passion to want to deliver quality and the best for that individual.
Come here and see what we do. I think people have a vision of what oncology is going to be like. And I would say, come meet the team, talk to people, see what we offer, see how we function as a team. Cancer is still a dark word. And I think when you come here and you see what we've got and what we do and how we interact, actually the team is amazing.